Imagine this for a moment. You wake up one morning with a small, painful bump on your arm. By the next day, it's swollen, red, warm, and filled with pus. Naturally, you search online for answers. Within minutes, you're reading articles claiming it's Staphylococcus aureus. Another website says it's an STI. A social media post insists it means your immune system is failing. Someone else recommends buying antibiotics immediately. Suddenly, a tiny skin infection has turned into a frightening mystery. The truth is, very few bacteria have been misunderstood quite like Staphylococcus aureus. It's blamed for countless symptoms it doesn't cause. It's often confused with sexually transmitted infections, and it's one of the most common reasons people take antibiotics they never actually needed. Today, we're going to separate scientific fact from popular myth. By the end of this video, you'll understand what Staphylococcus aureus really is, why millions of perfectly healthy people carry it every single day, when it becomes dangerous, why it isn't considered a sexually transmitted infection, and how to recognize the warning signs that genuinely require medical attention. Let's begin with one surprising fact. At this very moment, there's a good chance that Staphylococcus aureus is already living on your body. Yes, right now. It may be living on your skin, inside your nose, or in other areas without causing any symptoms at all. And that's completely normal. Many people hear the word bacteria and immediately think of disease. But biology is far more interesting than that. The human body is home to trillions of microorganisms, collectively known as the human microbiome. These include bacteria, fungi, and viruses, many of which coexist peacefully with us throughout our lives. Some of these microbes even help protect us from harmful organisms. Staphylococcus aureus is one of those bacteria that can exist on healthy individuals without causing any illness. This state is called colonization. Colonization simply means the bacteria are present, but they aren't causing disease. Think of it like having guests in your home who quietly mind their own business. As long as they stay where they're supposed to be, everything is fine. Problems only begin when they enter places they shouldn't. That's exactly how Staphylococcus aureus behaves. The bacteria generally live harmlessly on the skin or in the nose. However, if they gain access to deeper tissues through a cut, scrape, surgical incision, insect bite, burn, piercing, or any break in the skin, they suddenly have an opportunity to cause infection. Once inside the body, they begin multiplying. Your immune system recognizes the invasion and launches a defense. That's what produces the redness, swelling, warmth, pain, and pus that characterize many staph skin infections. One of the most common infections caused by Staphylococcus aureus is a boil. A boil usually begins as a tender red lump before gradually filling with pus. Sometimes these infections remain small. Other times they develop into larger abscesses that require medical drainage. Staph can also infect surgical wounds, cuts, hair follicles, and areas of irritated skin. These infections have one thing in common. They tend to be localized. You can usually see exactly where the problem is. This is very different from the misconception that Staphylococcus aureus causes every unexplained symptom in the body. Feeling tired? Not necessarily staph. Having headaches? Not necessarily staph. Experiencing generalized body aches? Again, not necessarily staph. Those symptoms have hundreds of possible causes. No doctor can accurately diagnose a staph infection based solely on vague, nonspecific symptoms. Now let's address one of the internet's most persistent myths. Is Staphylococcus aureus a sexually transmitted infection? The answer is no. A sexually transmitted infection, or STI, is an infection whose primary method of transmission is sexual contact. Examples include chlamydia, gonorrhea, syphilis, genital herpes, and HIV. These infections rely mainly on sexual activity to spread from one person to another. Staphylococcus aureus doesn't. Instead, it spreads primarily through direct skin-to-skin contact, touching contaminated surfaces, sharing personal items like towels or razors, or contact with infected wounds. Could it spread during sexual activity? Yes. But that's because sexual activity involves close skin contact, not because the bacterium is sexually transmitted in the medical sense. The same bacteria could also spread between athletes sharing equipment, children playing together, healthcare workers caring for patients, or family members living in the same household. The method of transmission is what matters. Simply being capable of spreading during intimacy does not make an organism an STI. Understanding this distinction helps eliminate unnecessary fear and prevents people from drawing incorrect conclusions about themselves or their partners. Now let's talk about a version of this bacterium that truly concerns healthcare professionals. MRSA. MRSA stands for methicillin-resistant Staphylococcus aureus. This is a strain of staph that has evolved resistance to several commonly used antibiotics. As a result, infections caused by MRSA can be more difficult to treat. MRSA didn't appear overnight. Like many antibiotic-resistant bacteria, it developed through evolution. Every time bacteria are exposed to antibiotics, the most resistant individuals have a better chance of surviving. Over time, those resistant bacteria multiply. One of the biggest contributors to antibiotic resistance is unnecessary antibiotic use. Taking antibiotics for illnesses that don't require them, stopping treatment too early, using leftover antibiotics from previous illnesses, or taking medication without a proper diagnosis. These practices don't just affect one individual, they contribute to a global public health challenge. This is why healthcare professionals emphasize responsible antibiotic use. Antibiotics are remarkable medicines, but only when they're used appropriately. Now here's an important question. If you suspect you have a staph infection, how is it actually diagnosed? Contrary to popular belief, diagnosis isn't based on guessing. Your healthcare provider will first examine the affected area. If necessary, they may collect a sample of pus or fluid from the infection. That sample can be sent to a laboratory where specialists identify the exact bacteria responsible. They can also determine which antibiotics are most likely to be effective. This process is known as culture and sensitivity testing. It allows treatment to be tailored to the infection instead of relying on trial and error. Another area that often causes confusion is food poisoning. Yes, Staphylococcus aureus can cause food poisoning, but not because the bacteria invade your body in the same way they do during a skin infection. Instead, certain strains produce toxins while growing in improperly stored food. When someone eats that contaminated food, those toxins can trigger sudden nausea, vomiting, stomach cramps, and sometimes diarrhea within just a few hours. The illness is caused primarily by the toxins, not by the bacteria spreading throughout your body. That's why staph food poisoning is considered a completely different condition from a staph skin infection. Understanding that distinction helps explain why these illnesses behave so differently. So when should you seek medical care? If you develop a painful boil, worsening redness, increasing swelling, warmth around a wound, or pus draining from the skin, it's a good idea to be evaluated by a healthcare professional. These symptoms may indicate a bacterial skin infection requiring treatment. However, there are situations where immediate medical attention is essential. If you develop a high fever alongside a skin infection, if the redness spreads rapidly, if you experience severe pain, if you become confused, have difficulty breathing, or begin feeling extremely unwell, don't wait. Seek emergency medical care immediately. Although uncommon, Staphylococcus aureus can sometimes enter the bloodstream. Once that happens, it can spread to vital organs including the heart, lungs, bones, joints, and brain. This condition can become life-threatening without prompt treatment. Fortunately, serious complications are relatively rare when infections are recognized early and treated appropriately. The best prevention strategies are surprisingly simple. Wash your hands regularly. Keep cuts and scrapes clean. Cover open wounds until they've healed. Avoid sharing personal items like towels or razors. Practice good hygiene in gyms and shared facilities, and use antibiotics only when prescribed by a qualified healthcare professional. These simple habits go a long way in reducing the risk of infection. So, let's recap what we've learned. Staphylococcus aureus is a real bacterium. Millions of healthy people carry it every day without ever becoming sick. It becomes dangerous only when it enters parts of the body where it doesn't belong. It is not classified as a sexually transmitted infection. MRSA is a resistant strain that requires careful medical management. And the only reliable way to diagnose a true staph infection is through proper medical evaluation and sometimes laboratory testing. The next time you hear someone claim that every unexplained symptom is caused by Staphylococcus aureus, you'll know the science tells a very different story. Knowledge is one of the most powerful tools in medicine. The more we understand about our bodies, the better decisions we can make about our health. If you found this video helpful, share it with someone who might benefit from it. And if you enjoy evidence-based medical content that separates myths from facts, be sure to subscribe. Thanks for watching, and I'll see you in the next